Well, joining us now is In Focus health correspondent Linord Moudou. Welcome again, Linord.
Thank you,
What do you have for us today?
Well, we have some news on HIV/AIDS. Researchers in France say a new strain of the virus that causes AIDS has been discovered in a woman from the African nation of Cameroon. The 62-year-old patient tested positive for HIV in 2004, shortly after moving to Paris from Cameroon. Researchers say her infection differs from the 3 known strains of human immunodeficiency virus that have been linked to chimpanzees. The new virus appears to be closely related to a form of simian virus recently discovered in wild gorillas. Researchers say the woman currently shows no signs of AIDS. And the United Nations-backed Global Fund to Fight AIDS, Tuberculosis, and Malaria recently signed a grant agreement with Togo worth $20 million over 2 years. The 5-year grant will allow the country to scale up treatment and care for people living with HIV.
Togo is a country of 6 million people. Its rate of adult HIV infection is 3.3%. Here, antiretrovirals cost approximately $48 per month, which is costly for many HIV/AIDS patients. The country started distributing free-of-charge antiretroviral drugs as of November 2008.
We get medicines for free, but in terms of nutrition, it's very difficult. The state has to realize that nutrition is very important.
Patients who need free drugs must register with local medical committees or NGOs such as Espoir Vie Togo, an organization providing health care, medical treatment, and psychological support to HIV/AIDS patients. Elizabeth Asima Pacha is the head of the group.
In Togo, the fight against AIDS has evolved, but we need to make more progress, especially when we compare ourselves to other countries in the region, where caring for people living with HIV is much more advanced.
Part of the new grant will help efforts to reduce the transmission of sexually transmitted diseases and HIV among vulnerable populations. Strategies include the use of communication campaigns, counseling and testing, and the implementation of reproductive health care services. Michelle Casaccine is Executive Director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria.
If you may remember that a year ago, the financial situation here in Togo was really a crisis. A number of patients were in danger of discontinuation of treatment. And today's ceremony and signature is the result of a joint effort of all partners.
Augustin Kokovi Dokla is the president of the HIV Positive Association of Togo. He says this initiative is a progress.
This is good news. Initially, we only had 8,000 people, and after discussions and negotiations, we can say that we now have 17,000 people on ARVs in Togo.
The Global Fund is designed to attract, manage, and disburse resources to fight AIDS, TB, and malaria. Since its creation in 2002, it has approved $16 billion worth of funding in 140 countries.
In other health news, more than 1 billion people around the world are overweight and 400 million are obese, according to the World Health Organization. Voice of America's Carol Pearson reports U.S. health officials are attempting to combat this problem.
Jo Chidi has battled weight for most of her life.
When you're heavy as a woman, it's depressing. You know, it affects you emotionally.
This is what Chidi looked like before she stopped eating high-fat foods, began exercising, and lost 18 kilograms. New research shows that obesity costs the United States $147 billion a year, or $1,400 a year more for an obese person than for someone of normal weight. That's what a study funded by the U.S. Centers for Disease Control says. What's driving these costs are prescription drugs for obesity-related diseases such as diabetes. Health economist Eric Finkelstein is the study's lead author.
The only way to show real savings in health expenditures in the future is through efforts to reduce the prevalence of obesity and related health conditions.
Finkelstein says what's alarming is not just the number of Americans who have tipped the scales, but the pace at which they're doing it. Finkelstein says obesity affects all racial and ethnic groups, the rich and the poor, and most dramatically, America's children. 1 in every 5 children is obese or overweight. With food everywhere designed to tempt the taste buds, Dr. Thomas Frieden, the director of the CDC, says weight gain is hard to prevent.
If you go with the flow in America, you will end up overweight or obese. This is not a result of a change in our genes. What has changed is our environment.
Dr. Frieden says Americans consume 250 more calories per day than they did 20 years ago. He says the rising obesity rate is the single greatest contributor to a national epidemic of diabetes. To help combat the obesity crisis, public health experts discuss the need to change people's behavior by promoting exercise and good nutrition. Excellent. Federal stimulus money would go to local communities to encourage grocery stores to sell more fresh produce in poorer neighborhoods and to get more fruits and vegetables into school lunches. Finkelstein says because high-calorie, low-nutrient foods cost less than fruits and vegetables, it's harder to stay on a healthy diet. And as people use more technology, they tend to be more sedentary. As for Jo Chidi, she's excited about the changes she has made.
It feels great. I feel like a different person.
If only public health officials could bottle that enthusiasm and spoon-feed it to others. Carol Pearson, VOA News.
Well, for more information on these stories, go to voanews.com.
Well, of course, as always, we thank you, Linord Moudou, for
Sure.
a very, very interesting health roundup. And be sure, please, to watch for Linord Moudou every Tuesday and Thursday right here on In Focus for the latest health news.